Are you struggling to control your blood sugar, despite eating right and taking meds? You're not alone. The missing piece might be something simple, like a vitamin. Managing diabetes isn't just about cutting down on sugar, it's about giving your body the right support. Vitamins play a powerful role in controlling blood sugar, improving insulin function, and protecting your nerves and organs. Let's take a look at the top 5 essential vitamins every diabetic should know about, and how they can help you feel better naturally. The first, and possibly the most important, vitamin every diabetic should pay attention to is vitamin D, also known as the sunshine vitamin. Why is it so important? Because vitamin D directly impacts how your body responds to insulin, the hormone responsible for controlling your blood sugar. Without enough vitamin D, your cells can become insulin resistant, meaning even if your body produces insulin, it won't work effectively. The result? Higher blood sugar levels, more complications, and more stress on your body. Many studies have confirmed this link. In fact, people with low vitamin D levels are more likely to develop type 2 diabetes, and those already living with diabetes may struggle more with managing it if their vitamin D is too low. And here's the real concern. A huge number of people around the world are deficient in vitamin D, and they don't even know it. If you spend most of your time indoors, wear sunscreen all the time, live in colder climates, or have darker skin, your body might not be making enough vitamin D from sunlight. So what can you do? Step 1. Try to get 15 to 20 minutes of sunlight on your skin a few times a week. Early morning or late afternoon sun is best. Step 2. Add vitamin D-rich foods to your diet. This includes egg yolks, mushrooms, fatty fish like salmon and mackerel, and fortified foods like milk or cereals. Step 3. Consider a vitamin D3 supplement, especially if a blood test confirms your levels are low. But be careful. Too much can be harmful, so always talk to your doctor before starting any supplements. Some research even suggests that improving vitamin D levels may help your pancreas work more efficiently, giving your body a better chance to produce insulin naturally. So remember, before trying fancy diets or expensive treatments, make sure you're not missing out on the basics. Vitamin D might just be the foundation your body needs to fight diabetes more effectively. Next on our list, and extremely important for anyone with diabetes, is vitamin B1, also known as thiamine. This vitamin often goes unnoticed, but it plays a critical role in protecting your nerves, heart, and energy levels. And here's something you need to know. People with diabetes are more likely to have low levels of B1, especially if their blood sugar stays high for long periods. Why does this matter? Because thiamine helps your body convert carbohydrates into energy. Without enough of it, your cells can't function properly, especially your nerve cells. This is one reason many diabetics experience symptoms like numbness, tingling, burning, or pain in the hands and feet. It's called diabetic neuropathy, and a B1 deficiency can make it worse. But here's the good news. Increasing your B1 intake may help reduce nerve damage, improve circulation, and even support your heart health. There's also a special form of vitamin B1 called benfotiamine. It's more easily absorbed by the body than regular thiamine. Studies have shown that benfotiamine can reduce nerve pain and inflammation in diabetic patients, especially when used consistently over time. So how can you get more of this vitamin? Step 1. Include foods rich in B1 in your daily meals, such as whole grains, nuts, seeds, legumes, and peas. Step 2. If you have diabetic nerve pain or signs of deficiency, talk to your doctor about taking a benfotiamine supplement, especially if you've been diabetic for a long time. Also, if you're on certain medications, like diuretics for blood pressure, or if your diet is low in whole foods, your risk of deficiency is even higher. Vitamin B1 won't fix diabetes overnight, but it can help prevent serious complications and support your long-term health, especially when combined with good blood sugar control. So don't ignore those little signs your body is giving you. Support your nerves before the damage becomes permanent. Coming in at number 3 is vitamin B12, another essential nutrient, especially if you have diabetes and take metformin. Vitamin B12 is responsible for nerve function, red blood cell production, and energy metabolism. Without it, your body can't create enough healthy nerves or keep your brain and muscles functioning properly. Now here's something most people don't realize. One of the most commonly prescribed diabetes medications, metformin, can actually cause your body to absorb less B12 over time. So while it's helping to lower your blood sugar, it might also be silently creating a B12 deficiency, which can lead to nerve pain, fatigue, numbness, poor memory, and even balance problems. That's why many diabetics, especially those on metformin for more than a few years, begin to feel things like tingling in their feet, muscle weakness, or mental fog, and they don't always connect it to a simple vitamin deficiency. Low B12 can also worsen diabetic neuropathy, making pain and numbness worse over time. So, what should you do? Step 1. Ask your doctor to check your B12 levels, especially if you've been on metformin for more than 2 years. A simple blood test can tell you if you're low. Step 2. Include B12-rich foods like eggs, meat, dairy, and fish in your diet. Step 3. If you're deficient, your doctor may recommend B12 supplements or, in more serious cases, B12 injections for quicker results. For vegetarians or vegans, B12 is even more important since it's mostly found in animal-based foods. Just like with other nutrients, balance matters. You don't want to overload your body, but you definitely don't want to run low, especially when it comes to protecting your nervous system. So if you've been feeling tired, forgetful, or experiencing nerve pain, don't ignore it. Vitamin B12 could be the missing piece in your diabetes care routine. Number 4 on our list is vitamin C, a well-known immune booster, but also a powerful ally for anyone living with diabetes. Most people think of vitamin C as just a cold fighter. But did you know it can also help lower blood sugar levels and improve insulin sensitivity? Here's how it works. Vitamin C is a strong antioxidant. In diabetes, your body is under a lot of oxidative stress, which means there's inflammation and damage happening deep inside your cells. This stress makes it harder for insulin to do its job and keeps your blood sugar levels high. Vitamin C helps by reducing that inflammation, supporting your blood vessels, and making your cells more responsive to insulin. In fact, some studies have shown that people who took vitamin C supplements daily had lower fasting blood sugar and lower A1C levels over time. But that's not all. Vitamin C also helps with wound healing, which is especially important for diabetics. High blood sugar slows down the body's ability to repair itself. That's why even a small cut on a diabetic foot can turn into a big problem. By supporting collagen production and circulation, vitamin C speeds up healing and helps protect against infections. So, how do you get more vitamin C? Step 1. Eat fresh fruits and vegetables daily, especially oranges, strawberries, kiwi, bell peppers, broccoli, and tomatoes. These are loaded with natural vitamin C. Step 2. If your diet is lacking or you need extra support, consider a vitamin C supplement, but stay within the recommended dose unless advised by your doctor. High doses can cause stomach upset. One important note: vitamin C also helps reduce the harmful effects of sugar in your bloodstream by lowering levels of something called sorbitol, a sugar alcohol that can build up in your eyes and nerves when blood sugar is high. So whether it's helping your immune system, fighting inflammation, healing wounds, or balancing your blood sugar, vitamin C deserves a permanent place in your diabetes toolkit. Last but certainly not least is vitamin E, a powerful antioxidant that plays a critical role in protecting your blood vessels and supporting overall heart health. For diabetics, vitamin E is especially important because it helps protect against the oxidative stress that often comes with high blood sugar. This stress damages your blood vessels over time, leading to complications like heart disease, kidney disease, and poor circulation. Here's where vitamin E steps in. As an antioxidant, it helps neutralize free radicals, unstable molecules that cause inflammation and damage in your body. By doing so, vitamin E protects your blood vessels and supports healthy circulation, which is crucial for anyone with diabetes. Vitamin E also supports the immune system and plays a role in reducing blood clotting, which lowers the risk of heart disease, a serious concern for those managing diabetes. Studies have shown that maintaining sufficient levels of vitamin E can help lower your risk of cardiovascular problems in the long run. But that's not all. Vitamin E also promotes skin health, helping to prevent damage from high blood sugar levels, which can often lead to dry skin and wounds that heal slowly. So, how do you get more of this essential vitamin? Step 1. Include vitamin E-rich foods in your diet, like almonds, sunflower seeds, spinach, and olive oil. Step 2. Consider a vitamin E supplement, especially if your diet is lacking. However, don't overdo it. Too much vitamin E can cause complications. Stick to the recommended daily dosage and consult your doctor if you're unsure. Just like with the other vitamins, balance is key. Vitamin E can't replace medications or a healthy diet, but it can certainly support your overall health, especially your heart and circulation. So don't underestimate the power of this antioxidant. Vitamin E might just be the shield your body needs to fight the long-term effects of diabetes. These nutrients aren't just supplements. They're your allies in better blood sugar control, more energy, and a healthier life. Always remember to consult with your healthcare provider before starting any new supplement routine, especially if you're managing diabetes. I'm Dr. Sam, and I truly hope this video gave you valuable insight into taking control of your health. If you found this video helpful, do support the channel. Hit that like button, share it with friends or family, and don't forget to subscribe for more science-backed health advice. Stay healthy, stay strong.